most of the questions are being asked tonight by you. They were submitted by you through Facebook and through so many different ways. And we appreciate your questions from right here in the Coastal Bend. They range in scope from schools to jobs to how to enforce tomorrow's orders of reopening some businesses and what's next for our state as we look to rebound the local impacts of the coronavirus. Congressman Michael Cloud. Thank you, Congressman, for being here. Alongside Mayor Joe McComb. Mayor, thank you, as well as City Manager Peter Zanoni. Thank you, Peter.
You're
also,
welcome.
CCISD Superintendent Roland Hernandez. Dr. Roland Hernandez, thank you so much for joining us. And City County Health Director Annette Rodriguez. And also Nueces County Judge Barbara Canales, who was the one who really thought about coming together and doing this town hall so that we can answer your questions in a way that's more personable. So we thank you so much, County Judge, for that. And Governor Greg Abbott will also answer some questions later. I would love to open it up for just 30 seconds of everybody giving a real quick summary of what can we look forward to from here. Congressman, if you'd like to start.
Sure. I think the important thing to remember is that we will get through this. This nation's been through circumstances, whether it be war or other pandemics before. And we've done the right thing in coming together as a country. And we continue to do this. We're taking the first steps out. And so we can be encouraged and continue our work.
Also going to post information on how to get in touch with your office, Congressman, on our website, christv.com. Yes, County Judge Barbara Canales, 30 seconds.
I just want to say thank you to all of you, citizens of Nueces County, for helping us do what's right. You have been a partner like no other. And as a result, we have had very good statistics so far as compared to other counties. And I need your help now more than ever. As we reopen and help our community recover, start this reopening and start this recovery, we're going to have to stay really vigilant so that we can protect one another. I'm going to ask you to do this in the spirit of the order. You don't need a mandate to do what's right. I know I can count on you because you've been there from the beginning. And I look forward to seeing us definitely with sunny days ahead.
For sure. Thank you. Thank you, Judge. Mayor Joe McComb.
Well, when I'm asked this question, I guess the scripture that comes to my mind is that, weeping endureth for the night, but joy comes in the morning. And I think we're on the dawn of a new day. And I think if we don't abandon our common sense and the ability to make the proper decisions, we're going to come out stronger and better for it. We've got a great community, and I appreciate all their support and all of their activities. And it's a new day.
Yes. Thank you, Mayor. Peter Zanoni, City Manager.
Yes, thank you, Katia. I would say don't give up what we've learned over these last 8 or so weeks. We're not out of the woods yet by any stretch of the imagination, and there's still a little bit of work for everybody out there to do in our community. And as several persons have already said, we have a great community in Corpus Christi, and this pandemic has only demonstrated that more than ever. We just have to keep moving forward, keep in tune with information. And then finally, just a quick shout out to all the city employees that have either been on the front line or are working remotely. They're putting in tremendous amounts of time and effort to continue to have a high quality of life for our Corpus Christians, and we want to thank them as well. Thank you, Katia.
Thank you for saying that. Absolutely. City Manager Peter Zanoni, thank you. Real quickly, Annette, 30 seconds.
Well, our goal is to ramp up and to test as many individuals in this community as possible, especially those individuals that have symptoms. And we continue to be here for the community. You are able to call the 361-826-7200. Even if you have questions on we're going back to work and we want to talk to you about how do you see the social distancing, we'll work with you with your plans. Also, we've been working with the nursing homes and other congregate settings. So anybody that's needing assistance or thinks that maybe we can help them, please don't hesitate to call us and we will be there for this community. Thank you.
Excellent. And last but not least, Dr. Roland Hernandez.
Just a quick thank you to everybody on the panel today. Katia, thank you all for doing this. I don't only speak to our students in CCISD, I speak to all of our students around that can hear on behalf I'm sure, of your superintendent. We can't thank our teachers enough for what they do every single day. We miss our students and we miss our teachers and all of our employees from across the board. Thank you for all your hard work. Be safe out there, and we look forward to seeing you face to face soon.
Thank you. So let's get started, everyone. I want to start with the Congressman. Congressman Cloud, let's talk about unemployment. The Coastal Bend is dealing with two crises right now. We're talking about this pandemic and, of course, the surplus of oil around the world. It's going to cause a huge challenge for unemployment. What is Congress doing to combat our unemployment challenges?
When it comes to unemployment, there's a few things that we've done in Congress. The first thing is try to prevent unemployment as best as possible. One of the ways we did that was with the CARES Act. We had the PPP program, which is the Paycheck Protection Program. And the idea there is to keep businesses, to give the businesses the liquidity that they need to keep people on staff. And so small businesses that are able to keep their employees on payroll will receive a loan that helps them cover that payroll. And as they're able to keep them on payroll, that loan will be forgiven in the long run. And so that was the first goal. The second goal was the rebate checks that went out, where each family would receive a check, direct deposit into their account that was $1,200 for each adult, $500 for each child. And then also part of the CARES Act was a supplement of the state unemployment programs. And so we made sure that there was some funds in there to boost up what the state's doing when it comes to unemployment. And really at this point, we got to realize that it's the biggest thing when it comes to this, and especially when it comes to oil, is to get people back to work at this point as responsibly as we can. That's what people want. They want to be able to work. They want to be able to provide for their families. And so the sooner that we can ramp up getting people back to work, we'll also see part of the problem is the demand has sunk as people have stopped traveling and participating in the economy. So as that begins to ramp up, we'll see a lot of these problems over time. We have some challenges ahead of us, no doubt, but over time, we'll begin to work our way out of this as we've always been able to work through every crisis.
And people do want to get back to work, and they want to get back to work safely. Of course, exactly. Tomorrow will be phase one of the governor's plan, where certain businesses are going to reopen. We've received numerous questions about tomorrow's reopening, which means for the most part that malls, movie theaters, as well as restaurants can open at 25% capacity. We have a question right now from Henry Cervantes regarding this.
Well, how y'all planning on controlling the 25 capacity for the restaurants, the people going inside the restaurants?
Donna Jones asks the same question. She says, how is the 25% capacity for malls and theaters going to be enforceable? City Manager Peter Zanoni, you've seen the order from the governor that he has put out. I'm sure you and your team have reviewed that 64-page document. Talk to us about the implementation of that document for Corpus Christi.
Sure. Thank you, Katya, and good evening, everybody. So the city of Corpus Christi feels pretty confident that the business community is going to take the leadership role in helping to enforce the 25% capacity rule that's there from the governor. Our business leaders through the community have done an outstanding job over the past 8 weeks as we dealt with numerous orders from federal government, the state government, and our local governments. And so we feel that the business community, the corporate leaders will know how to continue the great work that they've done in enforcing that 25% capacity. One thing we do know, working with our city leaders, to include our CVB director, Brett Oding, is that many restaurants may wait till they get to that 50% or the next level that the governor allows. So some restaurants may not even open anyway at that 25% capacity. And that is true also for some of the movie theaters. We're seeing that locally, some of the big movie theater operations won't be opening up for a few more weeks or months still. So that's some of our thoughts on that. We do have a great police department here, and I've spoken with Chief Markle since the governor gave his orders, and he is ready to assist businesses if there's a need. We'll be accepting calls, and our police officers are doing a fine job already in managing a lot of the orders that have been put in place, and so they'll continue to do that. But we really feel that the business community is going to do this in a great way, and but we'll be here if they need help in enforcing some of those 25%.
Right.
Yeah.
Judge Barbara Canales, do you think that we're ready to open back up?
Well, what I think is we need to open in this phase one approach to reopening Texas. We are facing multiple disasters in the coastal bend. And that is evident not only in the oil crisis that you discussed earlier, but also with our just local economy. You know, we are not just an energy community, we're a tourism community. And so when you have your two main components attacked at once, along with public health, you are almost inside the eye of a hurricane. And even though it looks very calm in some instances, you know, with our stats being better than so many of our neighbors, there is no doubt that there is tremendous pain and tremendous suffering. But we have pledged great sacrifice. And so I think that we can do this as long as we do it responsibly. I was noticing Congressman Cloud's plaque behind him, and it said, be strong. And I think that that is really what we need to do, is we need to be strong in order to be safe. And so by working with the Restaurant Association here locally, by working with small business locally, and in every industry and in every arena, we can do this responsibly. So I have confidence that if we work together, we can achieve the goals that not only the governor wants for us, the goals that we want, which is a successful economy coming back in an appropriate, responsible way. So I think that on one hand, you know, obviously I'm cautious, but I think that the way that we have handled this crisis so far has demonstrated that we are ready to act when we need to act. And so as we reopen business in this phase one, make no mistake, we're going to be monitoring it closely. And this partnership that you're seeing live on television tonight is real. It's real, and it's strong, and it's solid, and it's able to act swiftly because we cooperate and we collaborate with one another.
I'm going to open this question to the entire panel who wants to jump in on this. But, you know, in his announcement on Monday, the governor emphasized that you're not required to open tomorrow. You know, a lot of businesses want to, and they will do what they can. But there are employees who say that they're scared to go back to work. Maybe this is more for the congressman, but what does that mean to the employee? Does that mean that they lose their unemployment benefits, or do they stand to lose the job if they don't go back come Friday?
Well, the unemployment program is managed by the state, so I'd have to refer you to the state as far as the stipulations of how that's going to be handled and the rules that'll be made. But I do think it's important to note that as the economy gets back and rolling, there's going to be people at every comfort level, you know, and as, for example, the theater's open, it'll probably be a little while before we see a packed theater again, and that's okay. You know, those who don't feel uncomfortable, there's no one forcing them to participate in the economy as it opens up. And so, you know, it's time for us to begin to take seriously both fronts of this war. You know, do it in a responsible way, and I think the governor and the president are doing their best. And I know the county judge and the mayor and the city manager and everybody involved in this whole process at every level is working together to make sure that we keep people safe, but that we also give them an opportunity to flourish and practice the liberties that our nation is famous for.
County Judge Barbara Canales, would you do anything different right now than what the governor is proposing?
Well, no, I support this phased opening. I think that what I like that the governor has allowed counties to do is he recognizes that not every county is the same. So one of the things I'm highly encouraged about and optimistic about is that the governor has sent and deployed National Guard all around us, all the rural counties, to have testing done. This gives me a tremendous amount of confidence and comfort. Also, I'm always in the process of requesting those resources that we need for testing at our local health authority. But I also monitor what CBRAC, our Regional Advisory Council, is asking for the same in-kind resources for our hospitals. So by tracking those resources and by seeing what's been deployed around us, the increased testing, as long as we can all be on the same page that we need increased testing, I do feel good. I want you to know that the order that I signed yesterday dealing with masks, and here's mine, and they don't have to match. You just need to have something that covers your nose. While it's not mandatory, Katya, I believe that what you're going to see is people all over Nueces County utilizing these masks, making sure that they cover their nose, they extend it over their chin and over their face so that they can properly protect themselves when they're in major public spaces, or here's a good one, when they're using either share rides, taxis, or public transit. I think by doing these things, we're going to be better prepared than we ever were.
I'm glad that you brought up the subject about tests, Judge. I want to direct this question to our City County Health Department Director, Annette Rodriguez. Annette, how readily available are the COVID-19 tests right now in the city and in the county?
Well, we're very fortunate. The state actually sent us 500 of the specimen collection kits on Friday, and so we used 100 on the drive-through on Monday, so we have 400 in hand, and so we're ready and willing to test as many people as feel they have COVID-19 or they have symptoms of COVID-19.
So at this point, it's 100 tests, for our community, even 500. Do you think we need to be more aggressive and have a more aggressive system in place to try to identify those positive cases?
More aggressive is better for public health, because everybody already knows, the earlier we can detect anybody with COVID-19 positive in our community, the faster we can isolate them, and the easier it is to contain this disease. So absolutely, but we do know that we have the help of the private physicians, the hospitals. Everybody's doing their part to make sure that if anybody seems to have any symptoms of COVID-19, they're testing them, sending them off to the commercial labs, which is a great additional resource to what we have in public health.
Are we still turning away people that are asking to be tested?
No, we're not turning away anybody. Everybody that calls in, as long as they have any of the symptoms that resemble COVID-19, which are very similar to the flu. So not just the fever, the shortness of breath, and the headache, but we're also looking at, additional symptoms such as if they have muscle pain, or if they have any kind of chills, or if they have a sore throat, or if they even have like vomiting or diarrhea, or a new loss of taste or smell. That seems to be very indicative of this new COVID-19 novel virus.
Do you need to have all of that in order to get a test, or can you have some of the symptoms?
You can have any one of those symptoms. The next drive-through will get you in as quickly as possible.
Congressman, back to you on this. What is the federal government doing to be able to provide us with more tests? How can we get more tests here in the Coastal Bend?
Well, this is one of those things, from the beginning, we've said that this is federally supported, but state and locally managed. And this has been one of those things. There's been a number of times the county judge and mayor and I have been on the phone call trying to track down supplies. And so they've been really good about telling us when they're running low, and we've done what we can to pull whatever levers are at our disposal. This really is one of those, people have said it's an all of government approach, and it really has been. And I think people should be encouraged to see how well, although imperfect, and any crisis is going to be imperfect, there's going to be a lot of lessons learned walking away, but how well everybody's stepping up to walk across the lines, to do whatever it takes to get the job done. And so I've really appreciated being able to work with the team here and doing what we can to keep up with the testing demands.
Yeah. How do we ramp up getting more tests here in the Coastal Bend?
Well, this all comes down to supply chains and demand, and we're way further. If we remember when this started, a lot of the efforts we've gone through for social distancing, the like, was with the goal to keep the curve, so to speak, below the threshold where we begin to overwhelm our healthcare system. And something that's probably gotten lost in all of this is a month down the road, like county judge said, we're not flat-footed anymore. We have more ventilators, we have more PPE, we have more masks. We have more testing kits available. We have new tests that didn't even exist 4 weeks ago that are available. And so everybody's working. Factories have been retrofitted and those kind of things to do whatever we can to continue to provide for the needs related to COVID. And it's just working as hard and quickly as we can to produce it. At this point, the needs have been funded, and when it comes to testing, the people making the tests can only make them fast enough to meet the demand. And so we're working to make sure that happens, and then as the needs arise in each community, working to try to match the needs with supplies. And
Judge, do you want to jump in on that question?
We've been able to work with our entire legislative delegation. So Senator Hinojosa, Chairman Hunter, Chairman Navarro, Senator Colhorst, all representing Nueces County, have been invaluable to us, along with the congressman. And these are often, we ask for things that everybody's looking for. It's not just that nobody wants to give it to us, it's that everybody is needing the very same things. But I will tell you, we have been so proactive from the get-go that it's paid dividends to not only keep up this communication, but I think what you're going to see, Katia, is in the very near future, we're going to be receiving machines that will allow us to test 500 in a day. When this happens, when we get these machines up and running, properly outfitted with the resources that we need to utilize these machines, you're going to see a drastic change in our ability to test here locally.
Tell me a little bit more about that. So we have this machine, it's capable of testing, again, 500 people a day. Is that what you just said, Judge?
It has the potential on a work day to test 500 people. And it's because of Krista Spahn being such an incredible partner in this community.
Is there a timeline? When are we hoping to see those tests done?
Well, I'm going to be working all day and all night to try to make sure that we get the requests in. The requests are formal, written requests.
So it could be a couple of weeks.
I know that they will answer the call. Congressman Cloud is going to get his request. He'll get to see it too, and we all get to work on it. Everyone moving from different angles, right? And that's what Texas does. That's what we do best. And
Mayor, City Manager, do you want to say anything to that about the testing?
Well, I think all of us are very supportive of having increased testing. I mean, that's the goal, and I think that will bring a lot. That will up the confidence level, I think, throughout the community. Is that the more testing we get, you'll see an uptick probably in the number of positives, but I think what you'll also see is a huge number of negatives, and I think that's what we're doing, is trying to build the confidence level back up so people will feel free to leave their homes and go to restaurants and go back to work and this sort of thing. So
sure,
the more information we can get, the quicker the better.
We've had the 3 deaths attributed to COVID-19 here in Nueces County. One of the victims, his name is David Perea. He was a Ray High School graduate. He was a traveling nurse, 35 years old. Now, he caught the virus in Nevada, and he died there, but we counted his death here. The same, it seemed, with the 74-year-old lady from Robstown. Do you think that the death count is fairly portrayed here? Are our statistics overstated?
I don't think they're overstated. I mean, that's not my area of expertise, but I think the system is that they're trying to track based on your origin of residence or your residence of origin. And so I can understand that. I mean, statistics are how they do things. Every death obviously is a sad experience for the community and for the family, and we're sorry for that. But they're just trying to, I think, keep a record of where people home base is, just like where somebody, you may be living in Washington, D.C. Well, where's your home? Well, my home's Corpus Christi, Texas, but I happen to be living in Washington. So I think they're just trying to identify. Now, they may, after this whole exercise is done, go back and say these were the original, homes of these folks, but the death actually occurred in something else. That's for the statisticians to work with. But I can understand the theory that this is where they're family is. This is where their homestead is, so to speak. So I have no qualm with that. I'm saddened every time we hear of a death, whether here at Corpus Christi or Nueces County, or really anywhere. I've experienced those notices before, and they're not fun.
Do you think it's a positive sign that we don't have that many people, it seems, hospitalized here from COVID-19?
Oh, I think it's a wonderful sign that we don't have, we've had very few hospitalizations, and our numbers are relatively small related to the rest of the country. So I think we've done a great job. The medical profession, Annette and her people at the health district, SPON, the other hospitals, I think people need to be proud of what's going on in Nueces County in terms of the community's response. I think they've been wonderful, and 99% of them, there's always that 1%, but 99% of the people, I think, have responded very positively to the request from the governor and the judge and myself to, stay home, don't roam, make sure you're washing your hands. If you think about it, this exercise is nothing more than what your mother, well, I was going to say 50 years ago. Your mother probably was just about 20 years ago. But what your mother has taught you all of your life. If you're sick, don't go to church. Don't go to school. Stay away from people that are sick. Wash your hands. Keep your clothes clean. Rest, and don't expose other people. And it's a pretty simple formula. That's the theory here is if you're sick, stay away from people. But the citizens have been wonderful in their response. I can understand their cabin fever and wanting to kind of get back out, and some will and some won't. And as soon as that confidence level comes up, it goes back to testing. So I think we're on the right track, and I commend the governor and the judge for the leadership and the city manager and them in getting us this far. But I tell you that the people on the front line, the doctors, the nurses, first responders, we haven't been sitting on the sidelines twiddling our thumbs. When we see something, we react relatively quickly. And I think you've seen the police chief and the fire chief. If there's even an iota of chance, if a first responder has been exposed, they isolate them, quarantine them. And I think you've noticed, Peter might be able to correct me, but I think every instance when we've done that, it's paid dividends, that they've been in quarantine for a few days or maybe just a few hours, and then they're out. But we took that precaution. And so we've done a lot right. I don't know that we've done everything right, but we've done a lot right. And I think this numbers show that in our statistics here in Corpus Christi, Nueces County.
And everybody, of course, is asking, they just want to be tested. They want to be able to know, do they have it? Are they carrying it? Are they asymptomatic? Because we all know, if we know the amount of the population that maybe is carrying it, can they stay home? What precautions can they take? Annette, can you talk to us about the death count? Is that part of the county? Why are we counting those other deaths that didn't happen here, just from people from here?
So for diseases or communicable diseases, that's just the requirement, the way the Department of State Health Services, how we've always done that. Like the mayor said, wherever they reside. And so these individuals, they reside here in Corpus Christi. They actually have a home here in Corpus Christi. While they may work in a different state, their residency is in Corpus Christi. So it goes back to wherever they reside. We have the question come up a lot with winter Texans, and they tell us wherever they reside the majority of the time. So if they're here 6 months and 1 week, then they're ours. If something happens to them or they have a communicable disease like COVID-19, we would count it as our resident, even though they may live in two different states.
Interesting. Okay. Dr. Roland Hernandez, don't think that we forgot about you. We got so many questions for you, especially regarding graduation. Let me start with a question from one of our viewers, Marie Cheatham, who says, will schools be allowed to hold regular classes in the fall? And I know that's looking ahead, but that's the question.
So what I would say at this time is we're hopeful that that will be the case. We are looking at re-entry plans to start the school year in the fall, but as you know, we kind of take it day by day and kind of gauge our situation. I do agree with a lot of what has been said. I agree with our mayor that this has been a time, while challenging, it has been good to see everyone come together and just support one another, all the entities communicating. And our parents, of course, our employees just wanting to know when might we go back to some kind of normalcy. We have made the call with our governor that their school is out for this year. I know that was another question. We are looking at summer school, which will be done remotely, just like we're doing right now. So we will continue to provide summer school, especially for the students most at risk. So if they were students who are either behind grade level or below grade level, or had some challenges even before the coronavirus, then we will be working with them through distance learning over the course of the summer. And then looking at ways to re-enter our schools. You know, I think for schools, you notice that in any communication so far, schools have not been mentioned. Public schools, private schools, charter schools, universities. The issue there is just that you have so many students in one place at the same time. And it's so hard to social distance students when you have 20 to 30 kids in one classroom. Now, the larger urban districts are even in a tougher situation just because of the numbers that get involved when you're talking about classrooms, but when you're talking about assemblies in the cafeterias and just needing to eat lunch, when you're talking about extracurricular and the number of people on a team, in a locker room, in a gym, not to mention the number of spectators when you have crowds that reach over 10, 15,000 people, it becomes very challenging. And so what I would say to that question is, while we're hopeful that we can get into the schools, that is something that we're not going to push too much, because we have 37,000 plus students whose safety is the most important, and another 6,000 employees.
And speaking of large gatherings, you know, the city of Austin, they have already said that they have canceled festivals and football and large gatherings for the next 6 months, even up to a year. So we asked the governor, what does he believe will happen with Friday night lights, with football being so important to us here in Texas, and of course in the coastal bend. And here's what he had to say.
You know, if there's anything I want to see happen, it's football. And we will do everything possible to try to have the state and the country in a position where it can happen. However, we have to follow what the doctors say and what the data show. And it's way too early to be talking right now about what may or may not happen in the fall. The first thing we have to do is continue to slow the spread of the coronavirus. We need to begin to gradually reopen the businesses in this state, allow people to get back to work. And then if all of that works, and if we have what are called therapeutic drugs, medicines that people can take who have contracted COVID-19, that may allow us to begin having larger gatherings come fall. But because we don't know yet and what those medicines are going to be like, it's way too early to predict.
And distance learning, you know, as you can imagine, it's been tough for a lot of families, especially if you don't have a job right now. So you're worrying about paying rent, you know, plus you have your child that now you become their teacher. What do you say to those parents who are watching this right now?
One, I can't thank the parents enough. You know, this is, to all of our surprise, and all of us who have children working full-time jobs, and some parents multiple jobs, 1, 2, 3 jobs, and have really counted a lot. Schools mean so much to so many families, and in schools we spend a majority of the time with the children, sometimes more than their parents, because their children, I mean, the parents are working so many jobs.
Right.
But they have done an amazing job to be full-time employees in their own jobs and then come home and help their students. We're very excited in what we've been able to do for our community. You know, we have, like I said, 37,000 plus students. We've really worked with our principals and assistant principals who've done an outstanding job, as well as all of our teaching staff. We have less than 100 or so students that we have yet to make contact with. We have made contact with all of these families to find out if their preference is either on hard copy materials to continue the instructional learning, or if they have the capacity to do distance learning. And so something that's pretty significant that we're doing now is we'll continue to contact the families we haven't, but we're assessing on the number of people who don't have the capacity for the distance learning technology-wise and going to be purchasing, 3,000 plus Chromebooks, laptops, to make them available for those families to have at all times. And as a student enters the district, it becomes almost like a textbook for them. For the families who don't have the Wi-Fi access in their neighborhoods, we're really working hard to provide extra access in our neighborhood schools that extend out to the parking lots, and even putting parked school buses that possibly could help spread more of that Wi-Fi access. And so every day, even this far into this situation, we try to find better ways to reach out to our students, their families, and our community. Not to mention the great work that our food service department has done in providing
and providing all the meals too. So absolutely. What do you do with the children who are falling behind?
Well, so that would be a group that we have to continue to reach out to. We know that the parents are doing what they can. We are not encouraging our staff to go make home visits. We're really keeping the social distancing, but we have many resources on our district website. We have links that they can contact us. We certainly can communicate with them daily if we need to by phone conversations, and some teachers do. But this does create for all superintendents across the state, regardless of size, is that we will have gone 5 to 6 months when we come back in September or late August, that these students have not been face-to-face in front of their teachers. And so while we're doing the best we can with the distance learning, we know just how important and a routine it is for our students to be there with their classmates and their teachers. And so for those, we provide more resources. We're certainly going to target those who we think might be falling through the gaps as the highest priority for summer school, and then a transition into the next school year.
So summer school is definitely not happening at schools. It's going to be via distance learning, right?
Well, that's the plan right now. I wouldn't rule it out completely. We'll take our guidance from our commissioner and our governor. I will say that they, along with our city leaders, have done a remarkable job. We have at least 2, if not more, weekly conference calls with our education commissioner, Mike Morath, who is in daily communications, I'm sure, with the leaders in Austin. He keeps us updated on what the state is looking at, considering, and taking a lot of suggestions and ideas of what different schools are doing that could be best practices. And that's been the great thing, is to share with one another with 1,000+ school districts to see how different areas are handling it. And you're right, where we are in Nueces County is such a different situation than where they are in Harris County and Dallas and areas like that. And while our numbers might just creep and crawl a little bit, their numbers kind of explode from day to day. So you deal with what you have, and you consider your situation. And I do focus, as while I am trying to be a good resource to all of our surrounding communities and districts, we have a huge organization right here in front of us that we have to take the time, assess, and make the best decisions we can moving forward.
All right. And I have questions for you about graduation. I'll ask you about that in just a moment. I want to get back to our Congressman, Michael Cloud. Let's talk about our money. Let's talk about the stimulus funding from Congress. Right now, there's been approved more than $2 trillion for a country, a discussion of more money to come, Congressman. What do you think the next steps should be to secure and to stabilize our economy? And have we done too much or not enough?
Well, I can tell you, as somebody who's eminently concerned about the next generation, and I'm always weighing every bill that I have in the context of, how this is going to place a burden or not on the next generation, that whole idea of us leaving a nation better for our kids. And so I can tell you, I never imagined voting for a $2 trillion bill, but in the context of where you're at as a nation, if you consider that $2 trillion is approximately 4 to 6 weeks of our national GDP, and it's the aid now so far is closer to $3 trillion when you combine all the bills together. And of course, not everything in the bill is perfect. No bill is, but in the general scope, it's probably appropriate for what was. This is different than like the 2008 bailouts where you had bad actors come and then the bad actors were bailed out by the taxpayer. This has been something that is no fault to the taxpayer, to the citizens of our country. This is just something that was unprecedented. And so the government has, in a sense, at all different levels, shut down the economy. And so people can't go to work. They can't run their business. They can't do these things. And so the aid was warranted in this case for sure. At this point, we still have a lot of we have billions and billions and billions of dollars that we haven't gotten out yet that have been appropriated by Congress. So, for example, there's still almost $100 million to hospitals that still needs to get out. And the PP program, we went back last week and reauthorized another 300 plus billion for the PPP program. And so where we're at right now, it's good for us to continue to get out the funds that have been appropriated and to see what happens, to see where we're at.
Sure.
Of course, again, the biggest solution is to responsibly continue to work to open up the government, because eventually we can't sustain our livelihoods in the long run by borrowing money and deficit spending. So we'll have to work back to get our economy back working, so we can continue to pass on the liberties we've enjoyed to our children.
Yeah, and speaking of assistance, the governor did talk about SNAP benefits and the fact that those benefits have been expanded starting next month. If you receive SNAP benefits, you can actually use that to pay for online grocery shopping. Walmart and Amazon are the first retailers to join that program here in Texas.
You're exactly right. You're spot on. So it provides, if you would, these new and different strategies or ways that families can go about using their SNAP benefits, making sure that kind of whatever may be open, whatever may be available to them, they're going to be able to access in this situation that we're all working through right now with the coronavirus.
And again, that program is expected to be in place by May 18th, all throughout the state. Mayor Joe McComb, you know that there are a lot of folks without paychecks right now. Speaking about, the economy and of course unemployment, small businesses are hurting. The federal government, of course, is trying to help. You've got your own fundraising program that's providing aid. What do you say to people who are watching right now, who are not doing well and who are unemployed? What can the city do to help people get them employed and ensure that small businesses don't fail?
Well, first, I would, if you've been put on unemployment, check with your employer, see when they're planning on going back, whether it's a restaurant or whatever business you were in. But at the same time, we need to remember there were a lot of people that kept working during this process. I mean, we wouldn't have had the food at HEB. We wouldn't have the food to go at these restaurants. We wouldn't have had the doctors and the nurses. There's been a lot of people that have been working through this pandemic. And so for those that do need to get back to work, I think there are some programs for the small business person, the www.liftfund.com, if they'll get in touch with those people there. We've also, at the city level, we understand that utility payments come on a monthly basis, whether you've got a job or not. So we have, the city is contracted with Corpus Christi Hope House and also the Salvation Army. Both of those have contracts for about $800,000 each, to provide some assistance both in their utility payments so they don't get behind. And we got programs that can defer them. But what we want to do is, if you're on an hourly wage and you've been off for a month, and most in my business, a lot of people, they work from week to week. And so deferring is nice, but if you don't have to have that amount up, it's even better. And so what some of these programs will do is they will just, if you meet the criteria, they will pay that bill. So you not only have the utilities that you currently are getting, you don't have that added on to what you owe. And that really gives people a lot of relief, and both the Hope House and the Salvation Army can help with utility payment and also for mortgage and rent payment. So I would encourage people to contact those agencies. They've got some funding. That was the money that was provided for them. And so, again, don't let pride get in your way. This is something that, while you may have a lot of pride, you don't want to ask for help. There are times that that's a good theory, but there are times when you need to say, I do need some help, and that will keep my family going, and that'll keep my business going. And in the long run, that's when you ask for help. There's a lot of people out there wanting to help. And you mentioned the fund that we're moving forward to. We've generated over $270,000 in the Mayor's Disaster Fund, and that goes through the Coastal Bend Community Foundation, and that goes to nonprofits that are helping people. So that maximizes the amount of dollars that are being given, and the public has been very responsive. There's no tax dollars in that fund whatsoever. There's no bureaucracy. I mean, that money's come in and gone out within the last 15 or 30 days. There's about one more round of money to be given, but we want to get it to people that need the help as quickly as possible.
There's a lot of help, and we also have a lot of information on our website, christv.com/rebound. That is definitely one of the places where you can turn to for a lot of places that are trying to help as well. Annette Rodriguez, we have a question from a viewer for you. It says, how well are we prepared to contact trace, and how much contact tracing has been done? Are contacts giving antibody tests? What is the timeline that is used by contact tracers, and where are contacts asked to isolate it? That's from Kathy and Dan.
Well, and that's a great question, because contact tracing is probably the most important part of this whole containment effort for COVID-19. And so we currently have 14 individuals that's all they do day and night is contact tracing. They're very, very good at it. We have set a 2-day turnaround time for them, and so they know that if it's a positive COVID today, by Saturday they have to be finished with that whole contact tracing. If they are unable to do that, they need to be asking for an additional individual to help them, or 2 individuals to help them with that. So early on, it was a much more difficult task because a lot of people were still traveling. But now that they're not traveling as much and they're staying at home, it's a much faster process. And again, they know what they're doing. They're excellent contact tracers. They start with, like yourself, Katia, if you were positive, they would ask you, who's in your family. And then once you've talked about your family, who have you visited within the last 2 days? And then they ask about your work environment. Where have you gone? Have you gone out to eat? Have you, all of these things come into play. And so, and they document everything. So we also look to see if we have any COVID-19 transmission from one index case to another. So we're constantly trying to, first they just see the small picture, but then to put it all together to see, are there any bigger pictures that maybe they can't see because they're just focusing on one. We're also looking to see, are there any.
Oh, I lost you there, Annette. I don't know if your signal's going to come back. I lost you there. I lost you when you said that they go out into the community.
Yes. Can you? So they go out into the community. Okay, there it is. So it's basically just trying to find out, if there's something bigger than what they see with one individual person. So they see one individual person and the amount of people that have come in contact with that one positive COVID-19. But we also look at the bigger picture to see if their COVID-19 cases are connected in any way. And so we're looking at, something that's larger than what they're actually looking at as individual contact tracers.
What are the chances that we can ramp up the amount of contact tracers too here in the county?
Oh, we definitely can. We have the people from the phone bank. So at any given point, we've been training them not only as intake, as talking to those citizens that are calling, but we've trained them as also as being able to take what we call people under investigation to be able to go through our drive-through. And we've also just recently started the training to train them as contact tracers, because we know at some point when we are talking about businesses going back to work, we know, yes, that we're going to need to have more contact tracers to be able to do that. But we've set a 2-day turnaround time, and so we're very happy that these individuals are very good at what they do.
Let me get a couple of questions in real quick before we wrap up. Judge Barbara Canales, speaking of people being in, reopening and people being in places kind of close together, I have to ask you about the beaches. This was a warm weekend. There were a lot of people out at the beach. I know you saw that video. We took our cameras out there.
Yes.
What can we do? Is that safe for everybody to be out at the beach and like that? And how do you enforce the social distancing at the beach, especially when we've talked to people who are from San Antonio and said, you know, we drove in because this is where we want to quarantine.
Right. So you're right. Our beaches, we had a beautiful Coastal Bend weekend, and our beaches were very busy and very active. I was out there on both days. I'm out there anytime I get a call from a citizen or from Coastal Parks that lets me know that they think that I need to come and see for myself. Seeing is definitely believing. And also by being there on site, you can get more information than a picture can give you. And let me tell you what I mean by that. Our beaches are vast and expansive. And while it's difficult to control the enforcement provisions of the order, there is no doubt that people are doing it right, and there are some that are not doing it very well at all. And so we are going to ramp up our ability to have patrols to just encourage people to use their common sense. If I could have an order that would just be called the common sense order, this applies to our beaches. Beaches are beautiful because they are part of our, Gulf Coast assets, but they are also part of our wellness. It's good to exercise. It's good to get the vitamin D. It's good to swim and fish and surf and walk and jog. And it's beautiful.
But we need to do it appropriately, right? Not
Yeah.
by,
Right.
the video that we saw, it was a good portion of the beach, and you just
Yeah.
can find anywhere to be.
Right. And a lot of that, Katya, has to do with our access. So what we're going to do is 3 simple things to move on. We're going to basically increase our access to the beach, so encouraging people to move down. We're going to partner with we're going to begin talks with our federal partners next door at Padre Island National Seashore, and our state partners and our city and county beaches and Port Aransas beaches, where we formed a joint task force, and we said, look, as long as we are going to have open beaches, we're going to have some protocols that are consistent.
You have
So
to.
that's
Sure.
going to change. And we're going to ask people, Katya, to social distance because it's in their best interest.
You're asking people to follow that and not disregard
Absolutely.
take
that way
personal
they can
responsibility on that.
Right. And that way that keeps their beach open to them. But at any time, Katya, that we believe that it's not in their best interest for health, we have the ability to pivot and to change and to do what's necessary.
I want to get to some quick questions from some viewers. I'm going to just ask it to the panel, whoever can take it and answer it just as quickly as possible. This one comes from Dr. Ben Vela. He asked via Facebook, how come certain people can acquire tests and the city county doesn't have any? If we do have a surplus, can we begin random testing?
Kathy, I'll take this one. We would love to random test. That actually would give us a real pulse on what we have in the community. And so when we do have enough, and I think we will have enough at some point, specimen collection kits and all the other kits that we need to run the whole gamut of tests, when we have enough, that is what our plans are, is to test as many individuals in this community or as many households as possible so we can actually know what we have as far as COVID-19 in Nueces County.
Ismael Blue Vaca asked about social gatherings. Will there still be a limit come tomorrow on how many people can gather?
I know Peter Zanoni and I have talked about this at length and along with the mayor, and I just want to say that it's dependent. All gatherings have to occur somewhere, and those venues are going to be determined by their capacity to open. So that 25% rule is going to dictate a lot of those social gatherings. But I would say that you should go back to the original recommendations, which are to limit your social gathering, to limit your non-essential travel. This is not an opportunity to completely forget all that we've learned. I think we need to be really smart. You asked me if I think this was a good idea. It is, if we can do things right, stay strong, stay safe, and I would not recommend having large social gatherings. I would follow the guidelines of the venue that you're having your gathering, and allow them to dictate
From
the
there.
capacity.
And we have a video question from our viewer, Lena Vasquez, regarding graduations.
Will the kids be graduating or having a graduation, and how long will it be before any of this goes away?
We had our normal graduation dates set for the year. We did hang on to those dates, again, hopeful and wishful thinking. Not very likely those will occur on those dates since, you know, we're closed for the rest of this school year. So we moved those dates back to July, hoping that some of this will settle down by then. If we cannot have the graduations in person like we normally do at the ABC Center, there's so many things to consider, even with social distancing. In our district, we've never required students to only have a certain number of invites. It's been open to the entire public.
Mm-hmm.
And at the ABC Center, we get standing crowds only for graduations, and we do 9 of those. So what I can say, though, to the general question is, yes, there will be graduations, and it may be virtual, but we're going to make it a special time for our seniors and their families because, as you all know, through your own kids and those of you who have some coming up, we all look forward to that day. So, yes, there will be graduations virtually for sure if we cannot have them in a gathering of any kind.
Thank you. Thank you so much to all of our city leaders, all of our panelists. Appreciate your guidance and your leadership during this time, and thank you for your time. And listen, as we leave you tonight, we want to thank everybody again for being here and helping us rebound from this pandemic. For more help on navigating this rebound process, from who's hiring to what state and local leaders are doing to get us through this, we do have tips and stories for you on our website at christv.com/rebound. And if you have any questions or any story ideas, please email us at rebound@christv.com. On behalf of all of us here at Chris 6 News and KZTV, thank you for watching.
The Chris 6 News Coronavirus Town Hall has been sponsored by the Davis Law Firm. Hurt in a truck or car crash? Call the Fours, 444-4444.